My name is Jeff Lancet. I'm the chair of the Malignant Hematology Department at Moffitt Cancer Center. I'm also a specialist in the treatment of acute leukemias. Well, at Moffitt Cancer Center in our department, we are working in several different areas related to AML. With respect to VYXEOS, we are looking at a couple of different areas. One is to better understand the molecular predictors of response to VYXEOS. In other words, are certain mutations or genetic abnormalities more associated with benefit from VYXEOS, so that we can, in the future, perhaps fine-tune our treatment and decide upon VYXEOS for certain patient populations based upon the genetic and biologic features of the disease. We're also trying to understand how deep of a remission that VYXEOS can induce. So typically the deeper the remission, the better the outcome for the patient, and there may be some patients that achieve a very deep remission that ultimately benefit the most from the transplant or even without the transplant. And again, looking at the depth of the remission may indicate the overall success of the therapy. Probably most importantly, we're looking at the ability to combine VYXEOS effectively with other targeted therapies, as I mentioned before. At our center, we're running clinical trials that are combining VYXEOS with gilteritinib, which is a FLT3 inhibitor. FLT3 mutations are common in all types of AML, and the ability to combine a more intensive therapy like VYXEOS with a more targeted therapy like gilteritinib, we hope will yield positive results. We're also doing a clinical trial combining VYXEOS with Mylotarg or gemtuzumab, which is an anti-CD33 antibody drug conjugate, and CD33 is commonly expressed in AML, and we're hopeful that the combination of these two drugs, VYXEOS and gemtuzumab, will also yield positive results in the future to improve upon the outcomes that we're seeing with VYXEOS alone or with gemtuzumab alone.